Xfinity XFi is more than just fast. It's internet that gives you ultimate control. With the XFi app, you can pause the Wi-Fi at the push of a button. Can your internet do that? Learn more at xfinity.com/XFi.
There are very few local organizations that can say they have experience dealing with the worldwide flu pandemic. One of them that has been serving the South as well as the entire city of Chicago was in existence during the Spanish flu pandemic of 1918. And that organization is Ada S. McKinley, and we are joined right now by Jamal Malone, who is the CEO, to spread some good news about how should we approach these trying times. Jamal, thanks for joining us this morning.
Good morning, Darryl. How are you?
I'm doing very, very well. It's hard to realize that Ada S. McKinley was founded during the time of the Spanish flu.
Yes. So in 1919, our founder, Ada Sophia McKinley, she started our organization right in the middle of the Spanish flu pandemic. Founded us right on the south side of Chicago to provide services for the people.
That is absolutely incredible. And people don't realize this, but, unfortunately, we're heading toward, over 100,000 people that have died from this disease. But the Spanish flu actually took out tens of millions of people worldwide.
Yeah, when you think about that, it's really impactful to know that there's an organization founded by someone that looks like us, staffed by people that look like us in our community, right on the south side, with experience dealing with not just the pandemic or a costly virus or flu or COVID-19, but that understands our particular needs. And we're right on the front line. We've been doing it for over 100 years.
And in doing that, it's probably fortunate to say that Chicago has these anchor institutions that have just this wealth of experience in terms of whether it's COVID-19, whether it's World War I returnees, or dealing with black folks in terms of the ravages of Jim Crow migrating from the South. Ada S. McKinley has always been there. And how are you able to cater your services around the unique needs of the community?
Well, COVID-19 in particular has been very costly to our community, costly both to our lives and our livelihood. And I just wanted to pause to acknowledge that there's so many folks that have been impacted and will be impacted by not just the healthcare piece and loss of life, but in addition, just the economic front that's coming that we'll have to deal with once again.
Yeah.
But particular ways that we've been dealing with it is through our programs and really keeping our programs running and going on the front line at this time. I mean, specifically, we've got our foster care programs where many of the children are coming from abuse or neglect situations that we're remotely and still front responders trying to make sure that they have their needs in the foster care homes and that they're still able to sustain and grow and be nurtured. When you look at our mental health services, we're still on the front line with mobile crisis response. And with our outpatient clinic, even though we're doing and move some stuff to remote, where we're doing virtual and psychiatry and telecounseling, our main role of these programs is to really keep people out of jail unnecessarily and out of the emergency rooms for unnecessary mental health care, when the last thing that our hospitals need are more people showing up
to the emergency room,
further spreading COVID-19 through the emergency rooms. Other programs were right on the front line, e-learning. So we moved all of our early childhood development programs, our Head Start programs, to e-learning. And what we found is that many of our families aren't set up with the technology that some of our affluent peers have. And, they call it Head Start, not Left Behind, right? So It's Head Start for a reason because these kids need it. And what we've been doing is we've been sending tablets and ordering tablets for the children and families. And then where they don't have internet connectivity, we're working to get them hotspots so that they can continue with the lesson plans using virtual software and curriculum like abcmouse.com. So we're doing a number of different things. But one of the ones that's near and dear to my heart right now are facilities management programs. We have been on the front line for institutions like Great Lakes Naval Base or for other locations like Ludament, fighting COVID-19, the actual disease itself, through our custodial and janitorial services, where we've had to outfit our staff with PPE, the personal protective equipment, the masks, the face masks, the gowns, and really be able to clean and sanitize these locations to prevent the direct spread of COVID-19.
You're an essential worker, and you do this as an organization that also is dependent on the generosity of some donors. And how is it that you're able to provide these extensive services that are tailored uniquely for this disease? And what kind of plea would you like to make in terms of people that may want to assist in that effort?
Yep, I share this with my family and my children. We have 3 young sons. So I jokingly say it's like Little House on the Prairie over here, where we got the 9-year-old, the 11-year-old, and the 14-year-old all in one house learning and doing e-learning right now.
Yeah.
But I always
gives you a big shout out to teachers for sure.
Yeah, absolutely. And so I always say we've got to do what we've got to do so that we can do what we want to do. And right now, this is really about doing what we've got to do. And we really appreciate the folks that have stepped up. We've set up an emergency response fund, which is accessible through our website, adasmckinley.org. We've also, many of us are familiar with Silas Purnell and our famous educational services program, which has placed so many tens of thousands. I think we're above 70,000 folks that we've helped place into college. And these are alumni like Cheryl Burton with ABC7, who helped us celebrate our 100-year anniversary.
I was there. Fantastic event.
And then also, we've got other frontline folks like Dr. Suzette McKinney. She's the CEO for the Illinois Medical District. And so the fact that we've been able to help pay it forward, now we're coming full circle where we're moving our Trunk Scholarship program online and virtual. Mm-hmm. And because many of our high school seniors that we've supported, getting them into college, they've got a tough task ahead of them. They've got built-in trauma and built-in needs. So we moved our Trunk Scholarship program online, and instead of doing the traditional trunks to help them with the sheets and the bedding and the lamps and other things, we've moved it a little bit and shifted the trunks so that they'll have the e-learning, the technology, the capabilities, the flash drives, the hotspots. And so one way that people can support is stay informed with what we're doing. Go to our website. If you'd like to sponsor a trunk to help a senior going off to college, secure a trunk for them. But the most important thing is for folks to do what we've got to do so that we can do what we want to do.
Indeed. Do what you got to do what you want to do. As we get ready to close out here, why is it important to share good news, particularly about organizations that are here to service the community like ADAS McKinley?
Representation. It's important for folks to know that other folks aren't just coming into our community and helping us, we're helping ourselves. And so I think it's really important to see folks that look like us on the front line doing things and that we're helping ourselves, because when it's all said and done, we have to be there for each other and for one another. There's one interesting economic thing that I've been contemplating during this situation. Darryl, have you recognized that no one is talking about the debt ceiling right now?
Yeah.
No one is talking about government assistance.
Mm-hmm.
When affluent people need government assistance, they don't complain about it. They don't say the debt ceiling is too high. They take advantage of it. But as soon as times are good, they put it in blackface and make comments, nasty comments about people that utilize government assistance. And so right now we have to help one another because there's such a fight for government assistance. And we're seeing where historically we've been left out, and we will be left out in some cases. So we have to stand up for one another and make sure we get our share of the pie, but we're also supporting one another.
You were founded by a woman. What would you like to say this Mother's Day to mothers that are listening right now?
Well, first I'd like to acknowledge my mother, Sheila McIntyre. Single mom raised me growing up. And I remember some of the hardships that she helped lead and guide me and my two younger sisters through. So I'd like to say, Mom, I love you. Happy Mother's Day. And to my wife, who is running the Little House on the Prairie educational system at our house right now, Malone, I just let her know that I love her. And, as frontline responders, we recognize that all of the mothers right now are in a tough situation, making sure that they're caring for their loved ones, their families, and their children. And this is an unusual and unique Mother's Day, but just know that to all the mothers out there, we appreciate you, love you, and we know that you have been our rock for many years, just like Ada Sophia McKinley.
Sounds so very good. That is Jamal Malone, who is the CEO of the Ada S. McKinley Center. Thank you so much for joining us.
Thank you, Darryl. Always a pleasure.
Xfinity XFi is more than just fast. It's internet that gives you ultimate control. With the XFi app, you can pause the Wi-Fi at the push of a button. Can your internet do that? Learn more at xfinity.com/xfi.